Hello and welcome to my YouTube video. If you've seen any of my other YouTube videos, you know that I provide a lot of information to help everyday people understand the numbers that are being thrown around in all the discussions surrounding healthcare reform. I support healthcare reform, but while some of the proposals are good ideas, others are well-intentioned but short-sighted and could actually make healthcare affordability much worse, not better. If you've been reading the news lately or watching it on TV, you've probably heard a lot of stories of high rate increases. In fact, one major insurer was recently called before a House investigational subcommittee over their rate increases, some as high as 30 and 39%. Is it possible that such high rate increases could possibly be legitimate? Or is pure greed the only possible answer? Let's find out. I have another YouTube video called Why is Health Insurance So Expensive? During this video, I share numbers from the website of the firm PricewaterhouseCoopers. This graph shows PwC's estimates of how your healthcare dollar will be spent for 2010. The blue part of the graph represents payments to doctors, the yellow and green are inpatient and outpatient hospital cost, the orange is pharmacy, and the red is other medical cost. During that same video, I showed you that the typical situation I see, looking at the data for millions of Americans who are fortunate enough to have health insurance through their employer, the average health insurance company pays about $270 a month in health care cost. That's the part the insurance company pays, not the part you pay through deductibles, co-payments, or co-insurance. If you multiply this monthly total by the 12 months in a year, you get a whopping $3,255 per year on average paid by the health insurance company. Now, as I'm about to show you, this average can be much higher or lower depending on how high your deductible is or what part of the country you live in, etc. But first, let's look at another key figure. That same report from PricewaterhouseCoopers also forecast how fast the cost of healthcare will go up in 2010. We call this health cost trend. According to PwC, medical cost will grow 9% in 2010. I think this is a very accurate estimate. This figure is right in the middle of the range that I'm seeing right now in my work. So now there are two main questions we need to answer. One, where does this 9% trend come from? How can healthcare costs go up so fast? And two, even if 9% is the right figure, how can this possibly translate to those crazy health insurance rate increases of 30% and more? In this video, I'm going to tackle the first question. To find the answer to the second question, please watch my YouTube video, The Truth About Rate Increases. I'll have more on that later. For now, let's focus on this first question. How is it that we spend 9% more on healthcare? Not health insurance, but just healthcare. 9% more every year. Actuaries such as myself break up this 9% trend into a few different pieces. One is utilization. That is, people using more and more healthcare services each year. As the population gets older, we tend to use more healthcare. Next is what we call intensity of services. This piece includes the cost of new technologies, such as robotic surgeries and biotech. It also reflects more complex surgeries that are becoming increasingly common, surgeries that didn't even exist 20 years ago. The rest is provider contracts. That is, how much more do we pay doctors and hospitals than we did last year? The next few numbers I'm going to share with you are averages that I see, looking across the country. Typically, utilization increases about 1.5% a year. That means people use about 1.5% more medical services, more drugs, and more supplies each year than the year before. The intensity accounts for about another 1.5%. So all those new technologies and complex surgeries, that's adding about 1.5% also to your total medical cost each year. That leaves 6% for provider contracts. 6%. This is what experts refer to as the provider problem. When doctors and hospitals ask insurance companies for more money, they often tell the public they need that money to pay for the cost of new technologies and better services. But remember, we already covered that part in the 1.5% increase for what we called intensity. Remember that? So we can't count that part again. You might also hear doctors and hospitals say, the patients I see are sicker and sicker every year. It costs more money to treat them. Well, that's true, but that piece is also covered under this 1.5% figure for intensity. Remember this chart? Intensity already covers not only new technologies, but it also covers the cost of more complex procedures. So if patients are sicker and require more complex care, that's covered here too. Those sicker patients also need more services, not just more complex service. But that's what utilization covers. If patients need more and more services, that's all part of utilization. So the only thing that's left is just the provider contracts. Since we've already taken out utilization and intensity, these provider contracts are basically how much more do we pay doctors and hospitals to provide the same services next year that they did last year. So now back to this slide. Look at that figure again. 6% increases. Cost of living increases are more like 2 or 3%. During this economy, most of us are lucky to get any increase in our salary. Healthcare providers are demanding 6% increases, and as they provide more services, and as those services get more complex, then the total dollars paid to doctors and hospitals go up and up until we get this total increase of 9%. And keep in mind, this is every year. At this rate, our total healthcare cost will double every 8 years. Now, some doctors are going to look at this slide and say, I know I didn't get paid 6% more this year. Where is this 6% figure coming from? Well, here's the big secret that is finally getting some press just very recently. Doctors usually don't get 6% increases in a year. Some do, and some get more, but usually doctors get a good bit less than 6%. But hospitals, they usually get more than this 6%. In fact, the February 25th, 2010 edition of Health Affairs addresses this very issue. In the Health Affairs article, the author stated that these steep provider contract increases are the elephant in the room that nobody wants to talk about directly in the debate over health reform. These provider increases are what lead to higher health insurance premiums for all of us. The article spotlighted a study of rates paid by health insurance companies to the hospitals in California. From 1999 to 2005, the average annual increase was 10.6% every year. At this rate, their rates increased by almost double in just 6 years. Now, I don't want you to think that I'm saying hospitals are just run by a bunch of sleazebags. In their defense, they do cite factors that contribute to these high increases. For one, they complain about low payments for Medicare. As more and more of the population turns 65, then more and more of hospital patients are paid for by Medicare, which pays a lot less than insurance companies do. And also, as more and more people can't afford insurance, that means more patients who don't pay for the care they receive. Okay, so we've shown how healthcare costs are going up by 1.5% for increased use of services, another 1.5% for technology and complexity, and 6% more for provider contracting increases. All this combines for a total 9% increase in medical cost. But right now, you're probably still wondering, okay, but even if costs are going up 9% every year, why do I hear about people's rates going up 20% or more? That gets us back to our second question from the beginning of this presentation. Even if providers are charging 9% more every year, how can that translate to rate increases of 30% or more? For the answer to that question, please refer to another of my YouTube videos titled The Truth About Rate Increases. You can find this video on YouTube or on my website, fixthehealthcarebill.com. In that video, I explain how this 9% trend for costs paid to providers can actually translate into a 17.4% increase in average health insurance rates. And this 17.4% can easily translate into increases over 50%, depending on whether you're about to age into the next tier of premiums or how much your employer contributes for your premiums. So if you haven't already, you'll definitely want to check that one out. I know I just went through a lot of numbers. If you want to check my math, I will save my spreadsheets out on my website at fixthehealthcarebill.com, or you can find the same information on theanonymousactuary.com. If you would like to see more of my videos, you can find them on my website, or subscribe to them on YouTube, so you'll be notified anytime I post a new one. I thank you for your time watching today, and remember, my videos are not intended to stop healthcare reform. We need healthcare reform in this country so that all of us can afford good coverage when we get sick or injured, but we also need to realize the truth about the reasons for the rate increases we all face. Thanks again, and have a great day.